Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Yashti Madhu and I have purposely discussed Yashti Madhu on the basis of Gana described in Charak Samhita. There are two other Gana which are remaining. One is Snehopaga and Asthavanopaga. Snehopaga and Asthavanopaga. As it is Snigdha Gun, it is obvious that it will create Snehan Karma in the body. Always remember Snehopaga is generally derived in the case of Basti or in the any other Sneha Chikitsa. But Snehopaga should be taken that it will create Snigdhata or Sneha Dharma in the body internally as well as externally also. Then Asthaparavaga, because of Madhur Ras, it is Vatashamal and hence it is useful in the Asthapana Basti as a content. Now always remember, I have taken two examples of Dravya. First one Gudichi, that we analyze the application of Gudichi on the basis of the shlok described in the Bhavaprakash, and I have analyzed Yashti Madhu on the basis of Gana mentioned in the Charak Samhita. When you say that the Gana is say Kanthya, Varnya, etc., about a drug which is described in the Gana, it does not mean that that drug works only in that karma mentioned in the Gana. It does not mean that if a drug is mentioned in certain Gana, that drug performs only that functions only. It is not like that. It can be useful in other karma or srotas which are not described in the Gana. You will find many drugs which are not mentioned in the Gana. If the Gana have the combination of 10 dravya only, about the 50 Gana which have been mentioned in the Charak Samhita, there is a combination of 10 dravya in each Gana only. So many other remaining dravya which we use in practice, even they don't have any mention as a Gana in the Charak Samhita. So always remember, you can analyze the properties or karma on the basis of Gana, just like we discussed about Yashti Madhu, but it does not mean that Yashti Madhu is useful in the only in these Ganas and no other functions are clinically seen. So after describing the Gana, we will see the actions of the Yashti Madhu which are not in the Gana, but clinically it has got a very clinical importance. So firstly, Bahya Upayog, it is Shita Viryatma, so it is an excellent Dahashamak Dravya. Any type of Vispot, Visarpa, burns, anything which is burned in on the skin, and there is Daha, Yashti Madhu, along with Gruta, Lepa is the one of the excellent remedy. Madhur Madhur Shitas, all these are Pitta Shamak Gunadharma. So it is applied externally on the forehead in the Pittaja Shirashul, or the case like Ardhavaveda. Migraine like conditions, Ardhavaveda, it is a very good drug as external application. Yashti Madhu is very useful in Mukhapar. In the Mukhapar there are mouth ulcers, and as it is a Vanaropak Dravya, it has got a good effect in the mouth ulcers. Apply in the Gruta. As it has got a Ropan action, it is very good Dravya for Vrana Ropan. It's a very good Dravya for Vrana Ropan, as well as it has got Raktastamban action. So if there is a bleeding wound, always use Yashti Madhu to stop the bleeding, as well as use the Yashti Madhu to heal the Vrana. Vrana is the any type of wound. So just wound by trauma, it is useful, no doubt, but in the condition like perikartika or fissure, it is a very good drug to heal the wound. Of course, internal medication are required that we will discuss in perikartika, but along with internal medication, in perikartika, local application of Ishtimadu is has a great clinical results. So it is Daha Shaman, it is Rodaropat, it is Rattastambhak. Internally, it is a very good Udara Daha Shaman, Daha Prashamana. All the content are Pitta Shaman, so it is the best drug in whenever there is Udara Daha. I just said that it has got an excellent healing property, hence used in the Vrana. This property is applicable internally. It means internal wounds like all types of ulcers, gastric ulcer, peptic ulcer, ulcerative colitis like condition. I have used Yashti Madhu in many patients of ulcers and it has shown a great effect. So it heals the wound externally as well as internally also. Now it is other examples I uses Chadidigaranam I have already described. It is a very good drug in Kasa, Pranasudus Vyadhi. Now we can understand that it is useful in Kasa because of its Vata Shaman, and just you have to control the Shita Virya, so you can give it Koshtajalo as an Anupan to pacify the Vata dosh. But if it is useful in the Kafaja cause also, or Kafaja Shwas also. Now all the characteristics, Madhur Shita, Guru Snagdha, each and every factor is Kapavardhan, Kapavardhan. So still I am saying that it's a very good medicine in the Kafaja cause. Why? See, a patient comes to you and says there is lot of congestion, it is not getting out, expelled out. If it get expelled out, I will be relieved. So in this case, there is kapha vruddhi, but kapha is sthana. It has been adherent to the lung tissue. So patient tries to expel it, but in that effort, the sthanata gets more increased, and so more efforts are required, and so that's why the patient says that if there is something heaviness, irritation, or and if it gets expelled out, I will be relieved quickly. So though it is a kapha vruddhi, Jeshtamad is used here by snigdha guna, kledane snigdha. Kledan means to make moisture, olava. So in that case, the kapha vruddhi is there, but the kapha is sthana to the lung tissue, and hence it lubricates. Yashtimadu lubricates the sthana kapha and helps it to get expelled out of the body. Same like Snehan Karma we do before Panchakarma. Why? Because by Snehan, the dosh which are sthana to the dhatu or strotas get lubricated, and their adherence to the tissue of the body is nullified and they get separated from the body. So though it is kapha vardhak, it is useful in the kapha jakas when there is the sthana kapha first. If the cough is already expelling out, you can give that gati some more force by Yashtimadu, just like we see the Vamna Karma. So in stan cough, it lubricates the kapha dosh and gets relieved. If kapha is already getting expelled, it helps that movement or gati which is getting outside the body. Hence it is useful in Vata jakas as well as kapha jakas. I have described about Pitta jakas that it is hardly seen in my previous lectures. Another use of it is a excellent Bruhan Dravya, mainly works on Mamsa and Med Dhatu. So in Dhatukshay, in the Karsha basically, it is used for the Bruhan. It's a Rasayan Dravya what we have seen the points like the first by Dhatu portion answer, it is assigned Shukravardhak Gunadharma, all are, so it is naturally a Vrusha Dravya. In the case of uterus, when the uterus is small in condition, it is helpful to increase the size of uterus and give the strength to the uterine muscles. Other few examples there are like it is a very good dravya in Sadaha Mutra Pravritti, and it is a very good dravya in the Hikka also to get the gati of Vayu Anulom. In that case, you have to give it with the honey. So these are the other karma of Yashti Madhu which are not mentioned in the Gana as such, but it is we are using useful in the practice. So always remember, I am just giving an example like how to analyze a dravya on the basis of slok, how you can analyze on the basis of Gana. Next lecture I will add some another important point when you are using a drug in the patient. So wait for the next lecture. Thank you very much.